Okay, this video is the fat, stupid relative Thanksgiving video. Okay, so the purpose of this video is to try to help you. It's because one of your relatives wants to help you, but they're not able to convince you or you won't listen to them, whatever. So my name is Peter Rogers, Dr. Rogers. I'm a triple boarded, Harvard-trained doctor, first in my medical school class, expert on nutrition and health. Probably one of the best doctors, if not the best in the whole world. So I'm just going to tell you the truth, okay? First of all, no one cares about you. The medical system doesn't care about you. You know, hopefully you care about yourself. Basically, there's two ways to go with health. You can take man's way, which is eat all this meat, oil, processed food, makes you fat, sick, and stupid. They'll give you a bunch of drugs that don't work, and then the drugs will have less and less of effect over time. Then they'll start, doing surgery on you, chop you up, bye-bye money, prematurely dead, prematurely cognitively impaired. Or you can take God's way, the smart way. Eat a low-fat, plant-based diet, 100% vegan with no oil. Also, I'll teach you how to avoid toxins. Just this one video, that's all it takes. I can teach you more in 45 minutes than doctors learn all through med school or through a standard 3-year residency, okay? And you got a good chance to make it to about 90. No matter what you do, people usually die by around then, okay? The old view of health was just eat low-fat vegan, everything will be fine, low sodium, but now you got to learn a little bit about toxins because it's more complicated to stay healthy than it used to be. Okay, here's a few things I would just add to this chart. Also the EMF, speak on your speakerphone, because when you EMF your brain with you holding your phone to your head, you open up voltage-gated calcium channels. That's not good for you. Also, be careful with your teeth. Don't ever get root canal surgery. If you do and you're healthy, you might be able to handle it, but if you're not, you should get that removed. Avoid things that smell bad. They're all bad for you. Minimize personal care products. I'll go through the reasons for all this. Filter your water. All right, I'll explain so it'll make sense to you. You'll understand what you're doing. And, you're never going to be 18 years old again, but what I'm telling you is the best you could do. I've been studying this stuff for 30 years in great detail. This is the best you could do. It's the closest you've got to a fountain of youth to, these are old people coming in sick and then coming out young on the other side there. It's the best you're going to do, okay? If there was a better way, I'd let you know. So the fundamental problem here is that you're on your own. All medical doctors in the United States are grossly incompetent. They are very poorly trained. They might be trained how to read an X-ray and a CAT scan. They might be trained how to do their surgery quite well. That's all true. But they don't learn anything about what I would call, NETS, for example, NETS, nutrition, epidemiology, toxicology, all the things that start with the letter S. Stress, sleep, spirituality, sedentary versus exercise. They don't know that stuff. And those are the most important things that determine if you're healthy or sick. Okay, so that's what I say. What's the difference between a doctor and a zookeeper? A zookeeper knows what to feed the animal. The medical doctors, MDs, conventionally educated doctors, allopaths, they do not know. They are not educated in it, even at the so-called best medical schools. Okay, here's a couple things for you to know about. This is the Walter Kempner Rice diet if you want to study that. Here's the Caldwell-Esselstyn Best Results Coronary Artery Disease book. Here's my book on how to prevent and reverse AFib and CHF. High Blood Pressure Solution book by Richard Moore. I also wrote one on blood pressure. How to prevent and reverse diabetes, prevent and reverse obesity. The answers to these problems are well known. I'm now going to show you some slides that explain how it all is. So basically, if you want to be healthy, this stuff is obvious, but it's not taught in conventional medical centers. Okay, normal blood pressure, ideally something like 110/70, but it depends on your own body habits, how fat you are, how old you are. Okay, I'm going to explain what causes high blood pressure here in just a second. Around the world, there's places where people are a lot healthy, especially the best one is Okinawa, Japan, where people who eat low-fat, plant-based diets, they tend to be healthy, live longer, and avoid the common problems. And it's the same everywhere. Wherever they eat low-fat, plant-based diets, predominantly starch-based with no processed food, for example, they don't ever get high blood pressure. They don't ever get coronary artery disease. They don't ever get type 2 diabetes. The Yanomamo people that live in a jungle eat a low-fat, plant-based diet, and they don't, they got the same blood pressure when they're old in their 60s and 70s as they do when they're a teenager, okay? And they kind of live a crazy lifestyle. They're going around fighting all the time with the other tribes. But despite all that, they got normal blood pressures, okay, with no coronary artery disease. All right, and the same thing, too, for these other populations where they eat high-fat diets with a lot of animal foods or processed foods, they're fat and sick. Where they eat low-fat, plant-based diets, they're not. And Finland's a good example. A doctor named Pekka Puska in the 1970s and 80s, he had them quit smoking, eat a low-fat diet, lower their dietary sodium, eat more plant foods, and they had a 84% drop in cardiovascular mortality. The perfect would be 100% drop. You can't drop it any more than that. So the point is, it's easy to turn these things around if you know what to do. And by the way, I could care less about animal rights. I think most animal rights people are a bunch of phony jerks. I think they're a bunch of watermelons, meaning that they pretend to be green on the outside. Same thing with these environmentalists, but they're really red on the inside. Lefty pinko, commie, you know what I'm talking about, scumbags. Okay, so I don't go for those people at all. I'm just into this because of health, okay? I'm a Christian and proud of it. I'm obligated to tell you the truth, even if I think you're a moron, okay? So here is northern Mexico, where the Tarahumara live. These are the Sierra Madre Mountains. That means Sierra means like a saw. And here is the Pima in Arizona. The Mexican-American War, 1848, separated these populations. Before that time, they were together. The Tarahumara kept their old ways, eating a lot of corn, beans, local greens, squash, stuff that grows around them. And they're super healthy. They're ultra-marathoners. Every guy in town can run over 100 miles in 2 days. The Pima, who now eat a standard American diet, they're fat, sick, their health's a disaster. I'm just telling you this because I'm trying to show you it's not genetic. Don't ever say your health problem is genetic. Here's what they look like in the old days before they ate the American. They look like a college wrestling team, okay? Okay, and now the Tarahumara, like I said, they're healthy runners, no hypertension, no type 2 diabetes, no coronary artery disease. The Pima are all going for all the standard Western diets. They're fat, sick, cognitively slow, gallstones, gallbladder disease, appendicitis. These are all the things that Westerners get. Diabetes, diverticulitis, had their sigmoid colon taken out for that. The point I'm trying to say is the odds are good if you follow this diet. 1 billion out of 1 billion rice eaters in Asia, they're all skinny, okay? I went to college at Stanford. I saw all these rice-eating Asians. I never saw a fat one, not a single one, okay? High-fat diets Westerners eat, they tend to get most coronary artery disease, heart disease. They also get a significant amount of carotid artery atherosclerosis. The Japanese smokers in the 1960s, they were eating tons of sodium, like about 12, 14 grams per day, plus they were smoking cigarettes like chimneys. So they had a lot of hypertension from that, giving them intracranial atherosclerosis, but they didn't get coronary artery disease. They had very low rates of cancer. So if they didn't smoke and eat all that salt, they would have been much healthier. But I'm just telling you, the high fat's a major thing to watch out for. So how does it all play out, all right? If you eat the American diet, you're basically screwing yourself. Most Americans are fat, sick, and stupid by 55 years of age, and the vast majority by 60 years of age. So why shorten the health phase of your life, the health span of your life? There's lifespan, how long you live. There's health span, how long you're healthy for, okay? So if you eat the high-fat Western diet with oil and all this processed food and meat, you're probably going to have a heart attack. You've got a very high risk of cancer. You're probably going to be impotent. You're high risk for stroke, super high risk for hypertension and for diabetes. Why would you want to do that to yourself? It's just stupid, okay? The Japanese, Koreans, Chinese eating the rice. So the rice and veggies diet is actually okay. What screwed them was they ate way too much salt, sodium chloride is table salt, and they smoke like chimneys. Okay, that's what screwed them. If they hadn't done that, they'd have been reasonably well off. South Asians, that's like people from India, and the main thing that messes them up is they eat way too much fried food. Okay, they also eat some animal foods. They tend to eat yogurt and this ghee butter stuff, but the fried food is the main thing that's why you see a lot of these people, even though they're skinny and they'll tell you they're vegetarian, a lot of Indians are not healthy. Coronary artery disease, diabetes, other health problems. Okay, low fat, low sodium, vegan diet. You win on everything. You almost never have a heart attack, a stroke, and you're real low on all this other stuff. Why wouldn't you want that? It's what I do. I do it because it's the best you can do for health. If there was something better, I would do it. I don't take any supplements except vitamin B12. And then you're going to see all these paleo, keto, carnivore sirens on the internet. They're a bunch of BS artists. Big business has to pay people to lie to you. They just get somebody good looking, 40 to 50 years of age, and then all the stupid chumps go, well, gee, that guy looks good, she looks good, I'll do what they're doing. They don't understand. You're just being lied to. There's paid sponsors. The other thing you'll notice is I don't get that many videos on my channel. It's because I'm shadow banned. I'm ostracized. People who tell the truth to the pros are shadow banned and ostracized because they don't want the big business. They pay to promote all the nonsense. They want the public to be fooled because, think about it, it's a perfect revolving door business. Send you to McDonald's, send you to eat processed food, send you to eat all this meat. Then they'll send you to the hospital. They'll drug the crap out of you, chop you up. I mean, they make tons of money. Then they send you to the pharmacy, make all this money off you. That's how the system works, okay? And the Mediterranean diet is the big fake out. The Mediterranean diet, I call it the Antichrist diet because it pretends to save you, but it really destroys you. And it gets you fat and sick and stupid, hooked on pills every day. And then you have to pay for those pills, so the system gets money from you every day. It milks you like a cow, okay? See, Antichrist nonsense. And most doctors are going to think that's good because they don't know what they're talking about. They haven't really studied nutrition. Here's what it comes down to. Red blood cells on their outer surface have a negative charge. That charge is called the zeta potential. Because they're both negatively charged, they don't stick together. That's good. You don't want them to clot. Okay? A molecule that has a positive charge on its outer surface and is big enough will stick the red blood cells together. That's called overcoming the zeta potential. And when the red blood cells are stuck together, that makes your blood thicker, higher viscosity, more like a milkshake instead of normal blood that's like water. LDL cholesterol does this. It's a bridging molecule. It has a positive charge and it's big enough in size it sticks the red cells together. Other things it'll do it, IgM antibodies, uric acid, and the blood clotting protein fibrinogen. If you have leaky gut, the bacterial toxins will cause the fibrinogen to become more sticky, and you'll get more clotting in your blood, more prothrombotic. So the higher your LDL cholesterol, the more your red cells are stuck together, meaning the thicker your blood. The reason you have a blood pressure is to pump blood to the top of your brain, your cerebral cortex, which means you have to pump it against gravity. If your blood is thick instead of thin like water, you have to pump it at high pressure. If you eat a lot of sodium, the sodium from salt constricts your arteries, makes them narrow. Then you're pumping blood through a constricted system. So if you're eating a high-fat, high-sodium meal, like a pizza, for example, you now have to pump thick blood because the LDL cholesterol and the triglycerides and the chylomicrons, manifestations of a high-fat diet, are sticking those red cells together. So the blood is thick, and then you're pumping it through a constricted system because of all the sodium. Then your pressure has to go up even more to pump thick blood through a constricted system. So you're going to get more hypertension. The high blood pressure then injures the arteries, and the damage to the arteries causes clots to form. Atherosclerosis is a blood clot. So basically, high blood pressure causes atherosclerosis. High-fat diets also cause insulin resistance, meaning that they cause type 2 diabetes. So it's all bad. All this paleo, keto, carnivore stuff is just nonsense to trick low IQ pros, okay? So again, here's what happens. Normal red blood cells, 7 microns in diameter. Normal capillaries, 5 microns in diameter. When you've got bridging molecules from the high-fat diet sticking the red cells together, now it becomes like trying to push a submarine sandwich through that capillary. It's already a challenge to begin with because the red blood cell is bigger than the capillary. 7 microns red cell versus 5 micron capillary. So now you got to push this submarine sandwich-like thing through these capillaries. Pressure has to go up more. Rouleau formation means stack of coins in French. In American, we usually call it blood sludge. Same thing. They fed people high-fat diets with saturated fat or with PUFAs. PUFAs are polyunsaturated fats. That means like omega-6 cooking oils. And they check their blood lipids every 30 minutes once they started feeding them the high-fat diets. If they feed them no fat, like with just carbohydrates, starches, they don't get any increased stickiness of their blood. But when you feed them saturated fat or PUFAs, their blood becomes stickier and stickier, peaking in about 3 to 7 hours. It's even worse with the PUFAs, the cooking oils. And they noticed that this was done with patients that had cardiac angina, meaning shortness of breath or chest pain on exertion due to their coronary artery disease, atherosclerotic narrowing of the arteries of their heart. And what they found out is the more fat you feed them, the worse it gets, either PUFAs from cooking oils or from sat fat. Sat fat's really like animal fat, saturated fat. So the bottom line is fat is bad. It's impossible to be too low in fat. They've tested that. Your blood pressure has 2 numbers. The number on top is called systolic. The number on the bottom is called diastolic. Systolic means when the heart's contracting. Diastolic is when the heart's relaxing. Okay, so normal pressure is about 110/70 in general. A really high pressure would be something in the 200s on the top number and over 100 on the bottom number, okay? The higher the pressure gets, the more likely it is to damage arteries and cause atherosclerosis, meaning form clots in the arteries. Okay, you got something in your chest. The big artery is called the aorta. And the aorta has elastic fibers. So when the heart contracts, it pushes blood into the ascending thoracic aorta. So here's the left ventricle, contracts, pushes blood into the ascending thoracic aorta. That stretches it outward. Then when the heart relaxes and the muscle, relaxes, okay, what happens is then the elastic recoil fibers in the ascending thoracic aorta, they have elastic recoil inward, and they push blood through the aorta during diastole, during cardiac relaxation. So they maintain a more narrow pulse pressure. If you didn't have these elastic fibers, you wouldn't be able to generate much diastolic flow, so the second number would be much lower. And the point is, the more chronic your hypertension is, the more you're destroying these elastic fibers from overstretching them, and you can't replace them after maturity, after 20 years of age. So what I'm trying to say is you want to fix the problem ASAP, as soon as possible, because the more chronic your hypertension, the more you lose your diastolic fibers, and then you can start getting yourself into a vicious cycle whereby you're going to have to pump harder with each heartbeat because you can't generate diastolic flow during the relaxation phase of the cardiac cycle. And because of that, the left ventricle has to pump harder. Higher systolic pressure, meaning more systolic hypertension, meaning the top number is higher. The coronary artery muscles, they fill during diastole. They can't fill during systole because when they're contracted, the blood can't get in there. So because of that, you have to have the more prolonged, harder contraction. It's harder to fill those coronaries. But they need more blood because they're contracting harder. So you see how you're setting yourself up for a vicious cycle? Stronger contractions require left ventricle to need more blood, but the left ventricle, from contracting so hard, is getting thicker and it spends more time contracted rather than relaxed. You only perfuse it when it's relaxed, so it's going to become harder and harder to perfuse your left heart over time, predisposing you to congestive heart failure, which happens to people quite often when they've had hypertension for 50 years, okay, or 40 years even. CHF is really common. This is just a video. You can see this video at Dr. McDougall's YouTube channel. Dr. McDougall Health and Medical Center is the name of his YouTube channel. The video is called Blood Sludge, blood flow before and after eating a high-fat meal. The project was actually done by Swank. Dr. McDougall has it on his channel. Roy Swank was this MD, PhD from Harvard who figured a lot of this stuff out. And basically, it shows the red blood cells all stuck together. It's only 50 seconds long. I'll put a link to it in the description below. Once you see that video, you will remember it the rest of your life. It's rather shocking. Okay, and by the way, I did a fellowship at Harvard in vascular interventional disease. I've been working with atherosclerosis patients for many, many years. Okay, I've been involved in this stuff for over 30 years, and I'm trying to give you a chance. Okay, most people are a bunch of chumps, and you know the medical system has fun practicing on them, making money off them. When you eat plant foods like greens, like salads and stuff, the greens contain nitrates. That's NO3, nitrogen, oxygen. Okay, nitrogen bound to 3 oxygens. On the back of your tongue, there's bacteria that convert it to nitrites. This should be letter I here, which is NO2. Stomach acid then, once it goes down in your stomach, converts it to nitric oxide, NO. And then that goes into your blood systemically and causes vasodilation. That's also why you don't want fluoride in your toothpaste or in your water, because it'll kill these bacteria in the back of your tongue. Then you'll miss this first conversion step, and that can cause increased hypertension, high blood pressure, okay? You don't want it in your mouthwash. You don't want it in your toothpaste. You don't want it in your drinking water. You should get a reverse osmosis for your kitchen, for your drinking water, okay? And it's another reason why I don't like PPIs, proton pump inhibitors, for the stomach, because they block the stomach acid. Then you can miss out on the last conversion step. Okay, here shows what happens with blood flow. Blood flow should normally be laminar. It's like a hand. In the center is the red blood cells flowing at the fastest rate. Just to the side of that's the white blood cells, and then down here is the plasma. Okay, so the red cells flow in the fastest in the center of the vessel, and it's a parabolic velocity profile. It's normal blood flow, smooth and laminar. Okay, what happens then is the blood will come up and reach a bifurcation point. So here it is coming up the common carotid artery in your neck. You've got a carotid artery. It's like your hand. You think of your forearm as a common carotid. Think of your thumb as the internal carotid. Jam that up there. That goes up to your brain. These little fingers are like the external carotid, go to your face. The bottom line is the thumb is the important one, because that's going to go deep into your skull, up into your brain, through a hole in your skull into your brain. The more high blood pressure you have, the hypertension, the harder this blood slams against the bifurcation, the median divider here, and the more it'll bounce off of there, having turbulent flow. And it'll have more retrograde eddy currents. Backwards flow is called retrograde current or eddy currents. When you have excessive amounts of turbulent flow and retrograde eddy currents, it'll confuse the arterial lining cells. They're called endothelium. And they'll start to shed their antithrombotic, their anti-clotting cells. And it'll expose prothrombotic, pro-clotting adhesive cells like VCAM, vascular cell adhesion molecule. And you'll start forming clots on this vessel. That puts you at increased risk for stroke. So you don't want these high-fat diets, okay? And by the way, like I said, I'm just in this for health. I like the farmers. I don't like the animal rights people. I don't like the environmentalists, because I think they're a bunch of phony jerks, the vast majority of them. Not all of them, but 90% of them. And believe me, I work with them. I know them. I almost was a wildlife biologist. I know them quite well. I know exactly what I'm talking about. I know their names. Okay, so what I'm trying to tell you is atherosclerosis is partially reversible. When you minimize dietary fat, you can reabsorb the lipid core. Lipid means fat. You can reabsorb the necrotic core. You can reabsorb the acute clot. Atherosclerosis is a blood clot. You're not going to reabsorb the acellular fibrous tissue. You're not going to absorb the calcification. I know some people are claiming nowadays you can. I haven't seen it, so I'll believe it once I've seen it. But you'll also have the nitric oxide production come back to life in the endothelium, and that'll cause some vasodilation. That'll also inhibit platelet clotting, so you'll get improved blood flow. You'll get lowered cardiac risk pretty fast within a week. Okay, the main thing the arterial lining cells do, they're called endothelial cells, is they make nitric oxide. It's a gas. It diffuses into the lumen and inhibits the platelets from clotting. That's good. It diffuses into the wall of the artery, inhibits the smooth muscles wrapped around the artery from constricting, so the artery stays open. That's good. That's the most important thing they do. They're lined up and they're spindle-shaped and they're lined with their long axis along the direction of flow. So that's how they can sense abnormal flow, because it'll be in reverse direction or sideways direction with turbulent flow relative to their long axis. And they've got little cilia-like projections that can sense the direction of flow, mechanoreceptors. So they know if flow is normal or not. This is a guy by the name of Jack Delatorre. He tied off the carotid artery in a mouse, and what he found was middle-aged and older mice, after he tied off the carotid artery, 2 months later, they'd be demented. He did an autopsy on the mouse, expecting to see a big stroke where he tied off the carotid, but there was no stroke. The brain was just shrunken, atrophic. Okay, so an atrophic brain, that's what you get with a lack of blood flow. If you have a total lack of blood flow, suddenly, like a big blood clot, embolized up there to your brain, you'll have a stroke, dead brain tissue, okay? But more often what you get is a diminished blood flow to the brain, and you get progressively worsening function of that brain tissue, okay? And blood flow is called perfusion, so hypo means decrease. So this is the vascular hypoperfusion theory of dementia by Jack Delatorre. He's the guy who figured it out. And at first you're going to say, well, not that many people have an occluded carotid, so what? Oh, it's true, not that many people have an occluded carotid, but guess what? Lots of people are hypertensive, and that hypertension is damaging arteries in your brain all over the place, causing atherosclerosis in your brain. That's dropping blood flow to your brain. So it's like the mouse having chronic severe hypertension. And if you overtreat that hypertension, too much pills drive your pressure down too low. Well, now you're hypoperfusing, underperfusing your entire brain. You're like the mouse. It's the most common reason I think old people fall is they take too much blood pressure pills, drop the pressure to the brain, they fall. The reason you have blood pressure is to get blood to the top of your brain. So you got to be careful about overtreating it as well. A lot of people don't get enough blood to their brain because they've also got diabetes, atrial fibrillation, congestive heart failure, obstructive sleep apnea, aortic stenosis, aortic regurg. They can get it post-op from open heart surgery, post-CABG, coronary artery bypass graft, hypotension, called pump head with cognitive decline. I can tell you, some of my friends that are internal medicine doctors, they tell me every single one of their patients over 60 is mentally slow. I can tell you the vast majority of patients I see over 60 are mentally slow. Not all of them, but the vast majority. By the way, I'm 62, okay? And I was real fat in my 30s, but then I'm like, oh my God, I got to fix this problem. I started reading all this nutrition stuff. I'm like, holy crap, all the information is in these nutrition and food books. It's not in the medical books. And so I solved the problem. You know, it took me 4 years because I initially thought I could just do it on my own willpower, but then I had to learn. And basically just imitate the people who are skinny. What do they do all over the world? They eat low-fat, plant-based diets. That's the answer. That's what we're designed to do. Genesis 1:29, I put every plant on this earth that shall be food for you. Okay? Okay, and also Christianity makes medicine and health and science better because it obligates you to tell the truth. What did Jesus Christ say? He said, that which you do for the least of my brethren, you do unto me. Okay, you want that. It says all men are created in the image of God, therefore they're part divine, therefore you should not abuse them. Okay, you want that. You don't want atheistic Darwinism. Atheistic Darwinism says you're just a monkey that talks and therefore I have no obligation to you. I have to please the insurance company because they pay me money. I have to please the drug companies because they write all the rules, and if you piss them off, you get in trouble. I have to please the hospital corporations because they pay money. I have to also follow the rules, and the standard protocol says give the patient drugs, so I can't be sued because I'll have followed the standard protocols. I don't have to please you at all. If you die, it doesn't really matter. Okay, you need to know that. No one cares what happens to you. Therefore, you're on your own. Therefore, you better learn. And I'm giving you the straight scoop, giving you a chance, all right? Magnesium, which comes from plant foods, it's located in the center of chlorophyll, the photosynthesis molecule in plants, okay? Magnesium in our bodies, it binds to the second and third phosphate and ATP. That's the energy chemical in our blood cells. So it prevents this phosphate from popping off prematurely. That's what you want. Okay, a lot of times my version of the diet, I call it a Spartan vegan diet. You know, I was a college wrestler back when I was a young guy, and it's very Spartan. I don't have any extra added stuff. You can add stuff if you want, but you don't have to. Okay, this is what I call the diet nirvana pyramid, how you move from, you know, headed towards fat, sick, and stupid towards being healthy. So first of all, at the bottom in health hell for morons is paleo, keto, low carb. That's all a bunch of nonsense just to trick you guys. The SAD diet is just about as bad, you know, makes you fat, sick, and stupid at a young age. Okay, you'd be probably fat, sick, and stupid in your 40s with this, you know. These are all these women, they lose their looks so fast, okay. I've seen women who eat low-fat vegan, some of them are still hot up to 70 years of age. They still look good, okay. In a man's mind, when he sees a woman, he doesn't even do it on purpose, it just happens. A little question is asked in his brain, would you sleep with her, yes or no? It happens instantaneously, and your brain says yes or no without even thinking about it. Okay, it doesn't mean socially or emotionally you would sleep with her, but the brain says, do I find her attractive enough that I would sleep with her? And if she's fat, the answer is no. Okay, okay. So anyways, what I'm trying to say is, a woman, I see all these women, they put themselves out of the dating market by the time they're not even 40 years of age yet, because they eat the standard American diet, making them fat. Okay, in a man's mind, he's like, why risk approaching a woman when she might, you know, she might reject you in a hostile way. Her boyfriend, her brother, her father might want to beat you up or something. So, you know, our primitive self wants to reproduce. And if you can't reproduce with her, because if she's fat in the ancient days, that meant she was pregnant or she's postmenopausal, you ain't going to approach her. Okay, you're just not. You don't want to bang her. It's just a fact. Okay, Mediterranean diet's one step up. That's what all the phony, pseudo-intellectual, ignoramus, bullshit artists will tell you. It's stupid. Then the ones who studied a little bit will say, oh, lacto-ovo, pesco-vegetarian, but fish is a total disaster, full of mercury and fat, often fried, and other real toxic chemicals accumulate in it. Milk is, you know, increased prostate cancer risk, increased breast cancer risk, increased autoimmune risk, increased diabetes risk. You don't want that. Okay, a philosophic vegan says no animal food, but they'll still eat all these high-fat vegan foods. That's not much better. At least if you avoid processed food, that's more progress. And then you want to avoid all the sweets, added sweets. You want a kitchen reverse osmosis filter, ideally a whole house carbon filter. No oils, not one drop, including omega-3 is bogus. It increases your risk of atrial fibrillation, suppresses your immune system, increases the likelihood you'll become fat. No added sodium. You get enough just from the food you eat. There's some people who are exceptions to that, but they're really, really rare. Okay, no nuts, seeds, all that stuff is high fat, it's bogus. Soy is fake, okay, it's totally estrogenic. There's lots of problems with it. I made separate videos on it. Avocados are a disaster. Don't ever eat avocados. Don't ever eat guacamole. Avoid all sweets. Organic only. Eat fruit. Starches for most of your calories and fruits and veggies, okay? That's the health nirvana pyramid, okay? You get promoted to full professor of nutrition. All right, I'm going to say don't add sodium. I'm not going to go through all this sodium stuff, but I'll just tell you what you want to know is that processed foods are really high in potassium and they're really low in sodium. That's what you want. For example, fruits will have, you know, 100 to 500 times more potassium than sodium. That's good. A starch will have like about 15 to 100 times more potassium than sodium. That's good. Your cells run well on that, okay? Veggies are more like about 5 to 20 times more potassium than sodium. That's still good. Meat's probably about 4 to 1 potassium to sodium. That's not so good. It's a little bit bad, but it's not super bad. And then processed foods are the opposite. Processed foods will have higher sodium than potassium. That's a disaster. I'd never eat anything with higher sodium than potassium because that messes up all your blood cells. All your membrane ion pumps are dependent on a diet that's high in potassium, low in sodium. Okay, I gave much more detailed lectures about this. In my lecture on membrane ion pumps with metaphors, I explain how this all works. But the bottom line is there's no animal in nature that eats more sodium than potassium. It's really bad for your blood vessels, your entire body. The body has to maintain its osmolality, so if you're eating more sodium, you're going to lose more potassium. The ratio, by the way, of potassium to sodium is called the K factor, and you always want it over 5. You really want it 10 or more, okay? Our ancestors probably had about 20 to 1 K factor, potassium relative to sodium. Here's just a paper showing, overtreated hypertension is probably the main reason old people fall, okay? So That's often they start having a lot of falls the last couple of years of their life before they die. Okay, here's a paper, about black people. Anybody knows anything about black people and hypertension? Black people have hypertension off the charts. Really bad hypertension. Even the ones that think they're good about their health, they'll often be on 3 blood pressure pills. And so then you read all the books. I didn't learn anything about it in med school, nothing about it in residency. I was just told black people have lots of hypertension. It appears to be genetic. They're salt sensitive. There's nothing you could do. Okay, then you read the textbooks and they're all full of crap. They're like, oh, it's socioeconomic disparity. It's because of racism. All BS. That's all a bunch of crap. Okay, here's the truth. This is from Africa, 1929. It's in the Lancet Journal, one of the biggest best-known journals, back in 1929. There's no money involved here. Blood pressure in the African native, okay? This is in Kenya, okay? These are all adult men. What they found was, and they ate plant-based diets in Kenya at that time, 1,800 consecutive admitted patients to the hospital. In the United States, 80% of them will be hypertensive. In Kenya, in 1929, what percent were hypertension? Not a single case of raised blood pressure. They also checked the average 60-year-old man in Kenya. And they compared them with the Europeans at that time, 1929. The average European blood pressure was mildly hypertensive, 140/90. The average man in Kenya in 1929 had a blood pressure of like 105/67. Totally normal, same as like a newborn baby, like a teenager, okay? That's what I'm trying to tell you. When they ate a plant-based diet, they're fine. They had no hypertension. The reason why blacks got hypertension off the charts in the United States is they ate way too much processed food. There's your answer. Okay, processed food, like I just said, it's high in sodium, but it's low in potassium. That's really bad. That causes high blood pressure. It's also high in fat. So it's just like designed to cause high blood pressure. Okay, and high blood pressure damages your vessels. It thickens the arterial wall, causing like hypertrophy of the vascular smooth muscle cells and hyperplasia, thickening of the capillary basement membrane. That decreases ability to deliver oxygen to your tissue. So your function is going to go down, and your brain cells are going to get less oxygen. It happens gradually over the course of decades, but you'll initially just be, cognitively slow by the time you're 60. And you'll probably die, like in your early 70s, fat, sick, and stupid. Why do that to yourself? Why not stay sharp? I'm 62. I'm still mentally sharp, okay? And that's what you want, to keep your brains. Okay, here's just showing the brain, the internal carotid artery comes up, goes up over the cerebral convexities. They're called convexities because they're convex outward. And you got these little penetrating arteries going into the brain parenchyma, the brain tissue. And then here's the hard spot to get to. These are the cerebral ventricles filled with cerebral spinal fluid. These arteries go up. They're called lenticulostrides. And this is sort of the end artery territory. Very poor collateral blood flow in this region where I got the skull and crossbones. So if you overtreat your hypertension with pills, you drop your pressure too low, you don't perfuse this well, you get little strokes in here. Okay? If you're really high in your blood pressure, severely high, you'll damage these arteries as they come into the brain, and this will eventually become atherosclerotic occluded, and you'll tend to get little strokes in here. These are called lacunar infarctions. These are called periventricular flare hyperintensities due to small vessel cerebrovascular atherosclerotic disease. So that's just a fancy way of saying you don't have enough blood flow. Okay, so here's a normal-looking brain with normal-shaped ventricles and no strokes. Okay, here's a very typical brain I see. This would be like a typical American person in their 70s. A little worse than average, but pretty typical. Okay, so I would describe this as moderate to extensive periventricular flare hyperintensities. That means high signal, white, bright spots. And these are all small strokes. So this patient is not going to be that smart. They still could be able to, find their way home, but, this is not somebody you want to be your partner if you're playing cards, okay, playing bridge or something, all right? So here it is, the Spartan vegan diet, which is just very much the same thing as the McDougall diet, the Nelson diet, just low fat, 100% vegan, 100% whole foods. I only eat single ingredient foods because when you add a second ingredient, they can put something in there like MSG, MFG, and not even tell you what it is. Most of your calories come from starches, things like potatoes, sweet potatoes, rice, beans, oatmeal, quinoa. It could also be, single ingredient pasta, single ingredient bread, homemade bread. I wouldn't buy processed food bread. Fruits. McDougall says only get 5% of your calories from fruits. But if you exercise a lot and you're healthy, you can get much more. I eat about 35 to 40% of my calories from fruits. Veggies, 5 or 10% of your calories. Okay. McDougall says if a person doesn't know what to do and they want to get healthy fast, they should try to eat 90% of their calories from starch, 5% from fruits, 5% from vegetables. Dr. McDougall is considered the greatest doctor in the world, by the way, because he cured the most patients. Okay. So that's the best way to define how good a doctor is, their ability to cure a lot of patients. All right, then the only supplement you end up having to take if you eat this way is vitamin B12. You also want to maintain your social relationships. That lowers your stress level. You want to have a good purpose in life, whatever it might be, to be the best teacher, be the best coach, whatever it is, because that lowers your stress level too when you have a sense of purpose. Try to get your sleep every night as best you can. Religious people are a lot healthier than non-religious people, any of the major religions. Get some sunshine when you can. We're made to get some sun in the daytime. It helps set your circadian rhythms as well. Get some exercise, and if you can, at least walk. Ideally, do some strength exercise as well. And that's what makes humans healthy. So let's see if I got any more slides. That might be it. Oh, this is just showing the same thing in a little more detail. Oh, just a little bit on showing you the salt, blueberries. 100 times more, over 100 times more. A generic cereal, the processed food, 300 times more sodium than potassium, not a misprint. Okay, I'm not going to go into estrogenic chemicals. I'm just going to tell you to filter your water. But if you're drinking beer or eating meat, you'll have a tendency to be fat, and the man will have man boobs, moobs. Okay, there's other problems with these estrogenic chemicals. We're not going to go into all this stuff. Processed food is full of estrogenic chemicals. Estrogen's a fat storage chemical, so it makes you fat, increasing your risk of hypertension and diabetes. And they found this processed food, like on the non-organic corn sprayed with atrazine. That atrazine's a powerful feminizing chemical. It turns a male frog into a female frog. Okay, you don't want that stuff. What you want to do is live like Adam and Eve, but keep your indoor heating and plumbing. You only eat single ingredient whole foods that grow outdoors. Keep your indoor heating and plumbing. Genesis 1:29 said, I have put every plant yielding seed on top of the plant. It'll be food for you. So anyways, there it is. That's what it takes to be healthy. People who do that, they don't get the common Western diseases. Most Western patients, they all have the same disease. They're all hypertensive, and they're all pre-diabetic or type 2 diabetic. Those diseases cause atherosclerosis, which plugs up the arteries in their brain, makes them stupid, plugs up the arteries in their heart, lowers their exercise capacity, causes atrial fibrillation, which is a common cause of death, and causes heart attacks, congestive heart failure, causes impotence, causes hearing loss, causes blindness, causes back pain. So why would you want that? It's easy to avoid. Eat a low-fat, plant-based diet. So there it is. Happy Thanksgiving. I'm just giving you a chance to save your life. If you're smart enough to listen, here it is for free.